going to present to you is the animal model in different species for AMD. Before we start to do this animal model, I'd like to show you, first of all, the eye size of the animal. For human, the axial length is 24 to 25 millimeter, actually on the 25 millimeter side. For mouse, it's much smaller. It's only 3 to 3.5. The rat is bigger. It's 6.5 to 7.5. And the rabbit is even better, bigger, 15 to 16. And the pig, as you see that, the pig, the size is very much same as the human. So nowadays, people change to use the pig. Of course, the monkey, it has the macula, but monkey usually is smaller. It's sort of like infant size of the human and even smaller than infant sometimes. So keep that in mind. And I also like to show you the histology, how the retina look. This is human retina, and this is in macular area. I don't have the pointer here, but you can see that the ganglion cell, ganglion cell layer is much thicker. That means it's in the macular area. And compared to the other species, I apologize, this is a little autolysis, this particular pig eye, when we take the picture, so this is artificial loss. But what I want to see is show you is the monkey has the macula, have multi-layer of ganglion cell, not in the rabbit, not in the rat or mouse. The pig had a little bit more. And also one need to point out is the rabbit, the retina vessel is on the surface, not intraretina. So keep this normal normal histology in mind. And we know that the most common model for human nowadays is use mouse model. The reason, of course, mouse is much cheaper and produce quickly. And it is, main reason is mouse can be genetically manipulated to generate model of human disease and many diseases, that also including AMD. Although the mouse has no macula, but there is peripheral focal atrophy of photoreceptor and RPE, lipofuscin accumulation, and increased A2E in aging mouse. Therefore, it's still you can get some feature is similar to human. Also, one thing it should point out is drusen, as we all know that drusen is a hallmark for AMD, and that is rare to produce in mouse. The reason is one is the Bruch's membrane structure. It's a little different in human and mouse. The second, more important, is RPE. As you know that in human, when you have the waste material, you deposit it, go to the base and to the Bruch's membrane side. That's how the drusen there. But in mouse, usually the waste, they go up to the apical side, not the basal side, so had less opportunity to develop drusen. So keep that in mind. And this morning when I talked, someone, I don't know the audience here, is still here or not, asked me about the RDA. Yes, this is very important thing, and we find out actually couple years, 2 years ago, published IOVS first, and then the other one also confirmed that the mouse, we generate mouse, usually use 6N. You wanted to back course to 6N. But the 6N had, B6. The B6 had N and J, okay? The N, all the N, they all carry the CRB1 RDA mutation on one allele, as pointed out there. What happened is in 1950s, early 50s, the Jackson lab had a mouse. The other lab cannot have the mouse, the B6 background. So the mouse was, NIH had it. And the NIH somehow, don't know what happened, there was a mutation on this particular allele. So the 6N, all the stem cell or all those onyx cell line, all is from 6N. Many are from there. This is a very good article published last year that Simon, they look at the C57B and 6N or 6J, and same vendor to give 3 different institutions and large number. And you can see that what happened is different institutions, what happened to find out, this is a little difficult to see, but there was a retinal lesion there. And you can find out from 23% to 70% that they will have one eye. So this is variable from different, this is in fact is the same vendor, you can get different. But if they look at those 3 institutes, look at the 6J, and none of them had any lesion. So keep all this in mind. When you do experiments, since we have so many mouse, the genetic background is 6N. Not that you cannot use, you can use, but you just need to have better control as you think about it. Another mouse model, I think I should mention, there are many mouse models for AMD. One is CFH, as we all know that this is very close associated with human AMD. And this is the published here. Again, you can look at. And when they use human allele different for CFH, either the histidine or the tyrosine, which is the risk factor, you can see the difference. And this one will have deep lesion, in fact have more lipofuscin and shortening in a folding area, and also a little bit thickening of the box membrane, and you can see. But again, there was no drusen there, okay? So the mouse we have is the CCL2, CX3, CR1 mouse. They are on the RDA background. When we generate them, we did not realize there was RDA. We did not know, as I say, just 2 years ago we published. So we do see that there were lesions. This is the wild type, and you don't see it. Again, the wild type is 6N, and you remember the 6N is variable from institution to institution from different vendor. And our mouse, you can see all 100% of them will develop disease 4 to 6 weeks of age. The reason it's good for us because we have fellows. You know that the fellow, they come 1 year, they probably go, and some people lucky get 2 years. So if you had a mouse model, it need 12 months to develop. The fellow gone already. You cannot do experiments. So for us, it's good that 4 to 6 week had. The reason we use it is because CCL2 single knockout antibody, they reported there was deep retinal lesion developed in 9 months and older, some mouse. And the CX3 CR1, because we find out that there was moderate association with AMD in human. So we had the 2 mouse and we caused them and get that. And also the A2E is elevated in this mouse, the retina. And the confocal showed that there was positive in the RPE layer. So this is a good. And also now there was RDA mouse without RDA, DKO mouse without RDA background, which is Hopping Shoes Lab in Belfast. And they find out that there was also lesion, it's a little bit old age. But when you had the light exposed, they can have earlier, sooner that develop the lesion as you see here. And the RPE cell, you can see the big degeneration change. So if we use the 2 mouse, in fact we have and done it and we reported ARVO this year, that when we test, it would have similar effect. So we think that still you can solve cover. How we do that experimental design, we can have 2 good mouse. Again, if you give systemic, so you have this randomized by weight, and then you had treatment control, and also the wild type also treatment control, and then you compare. And which we did that for exam, it was 2 diet gave the mouse, and we found out that there was improvement. And the reason is, one of the reasons is because that formula will down-regulate the inflammatory cytokine as well as down-regulate VEGF. So this has some effect, we think. Another one you can control is self-control, that one eye you gave the control, and the other eye you gave the treatment, which I gave you example this morning for the IL-17 retina. And this is another publication that we use the FLT01, which is anti-VEGF, and again we find out that, and we think it's go through phosphate ERK, and then eye nose, and we'll have the whole effect. So how about rats? Rats is bigger than mouse. Basically, they have similar as mouse, and they just size different. There's a spontaneous model. One is the OXYS model. Rats, they have some rat, not 100%, and they can have increased oxidative stress. Another one is RCS rats. Many of you probably know and even use it. But remember, this is not developed focal retinal degeneration, but will have diffuse spontaneous retinal degeneration, and some are very quick. For example, if you have RD1 rat. Also, it's laser photocoagulation induced CMV. This is now widely used for the wet AMD model, but again, you have to remember this is trauma-induced corneal neovascularization. How about rabbit? I already mentioned that you have to think of the rabbit vessel, because the vessel is usually on the surface, not inside the retina. So also it's difficult to use laser-induced because the vasculature is different. And usually need to subretinal injection angiogenic material like matrigel, endotoxin, it's pro-inflammatory, or REG. And also you can do the suprachoroidal injection angiogenic substance, which mainly in elegance group, they have very beautiful picture. You can see the article. The pig is now recent news, again, because the pig they have relative high cone density similar to human. Also the size is very close to human. And also this pig had a central high cone density, but again, they don't have macula. And you can use one is the ELOVL4 transgenic pig, and they develop Stargardt-like macular degeneration. Of course, this is juvenile macular degeneration, not age-related macular degeneration, but it's similar. Also, it can use for laser photocoagulation, and here shows one of the paper. The surgical damage Bruch's membrane, and you can see this huge area of choroidal neovascularization. Monkey is very good that they have macula, just like human. There is spontaneous early AMD model. You can see that both in the maculae, rhesus maculae, or the mouse, and you can see this kind of drusen. But they don't go on to develop the dry AMD or wet AMD lesion like in human. Laser-induced AMD model in monkey have been done very early, and Steve Ryan, the late Steve Ryan, he popularized that, and in 1970s he already published, and you can see that, and the laser induced and the lesion, and very nicely. But of course, monkey is expensive and also involve a lot of ethical problem. This is the summary, and we just published the paper, and you can see different species, how to compare. Again, the mouse is very popular, as we say that it used, although there was no macula in the mouse, but used a lot. And the primate is good, but the cost and the ethical issue limited the use. The pig eye now is people starting to use that because the size and also have enriched cone. And again, the rabbit eye is not, no intraretinal circulation. You have to keep in mind, but it's good for PK study. All all this, no matter what mouse, all kind model you use, must remember that this is in the animal species, doesn't mean it's human. And how you translate this finding to the human and how to apply, that's very important, how to interpret and use it. Thank you. I'd like to acknowledge the co-author, Shida and Nick. They did a paper review, and also Dr. Tu, all the groups do our mouse model, and of course the lab people working on and use our mouse in all this year. Thank you again for all, and hope you do have time to see Baltimore.